think it's 5:30. Am I correct?
Yes, sir, it is. It's a little after,
5:31.
5:31. All right.
because I've got to exit for a ABAG meeting here in 40 minutes or so.
Okay. I'll have to catch up with you a little bit.
All right,
I'll
Dave.
try to power through this. All right. So good evening. I want to welcome you to the San Mateo County Sheriff's Office of Emergency Service meeting. Can we have a roll call and online meeting etiquette, Madam Chair?
Atherton,
Atherton, Terry Weiss present.
Belmont,
Davina Hurd,
Brisbane, Burlingame,
Ann O'Brien Kegren, present.
Colma,
Diana Colvin, participating by phone.
Daly City,
Glenn Sylvester, present.
East Palo Alto,
Lisa Gaucher,
Foster City,
Richa Awasti present.
Half Moon Bay,
Matthew Chittister, present.
Maria Chung, Hillsborough.
Hillsborough, yes. Present. Thank you.
Sorry about that.
Not to
Menlo
worry.
Park, Menlo Park, Millbrae,
Ann Schneider, present.
Pacifica,
Sue Waterloss here.
Portola Valley,
Don Richards here.
Redwood City,
Janet Borgen's here.
San Bruno,
Rico Medina here.
San Carlos, San Mateo,
Joe Goethals here.
South San Francisco,
Hey, Rich Garbarino here.
Woodside,
Chris Shaw here.
County of San Mateo.
David Canepa, present.
Deborah Penrose from Half Moon Bay is here.
Okay. Thank you.
Supervisor
Louise
Canepa.
Rogers from San Mateo County Health.
Yes,
Thank you.
Kevin?
Yeah, Supervisor Canepa, just as far as etiquette for the ESC members that are very well familiar, except for pre-arrangements for a couple, it'll be the raising of hands and acknowledgement during the Q&A. And for the members of the public, if you could please include your questions in the chat. Thank you, Supervisor.
Great, thank you very much. First of all, I'd like to thank everyone for participating this evening. Today, we're going to have an update from our county manager, Mike Callaghy, and a health system update from Louise Rogers. I just wanted to give you a quick update on the newest health orders that came out yesterday, because I'm sure many are familiar with it, but would be interested. Our latest health order was released yesterday, and it aligns us with the state's guidelines since we were granted a variance. In addition, the order limits gatherings not to exceed 50 people and allows for social bubbles, which basically allows up to 12 or fewer people from different households who agreed to socialize, only with the members of these groups. With all these new types of business openings, it is really important now to focus on our behaviors and practices in order to minimize the spread of the virus. We all know as a community, we need to take responsibility and accountability in wearing face masks, following 6-foot distance, social distancing rules, and hand washing hygiene, and limiting the number of people in regards to social gatherings. The good news is it's a step towards normalcy. What I'd like to do now is to take a few moments to thank and recognize the OES staff for all the work they've done in this COVID-19 epidemic. We are extremely fortunate to have the Regional Operations Center, or ROC, and EOC in place. Otherwise, the entire operations may have been conducted out of the old OES offices and adjourning computer classroom. The EOC was activated on Monday, March 2nd at the request of the Health Systems Department operations to assist in existing planned and expanded operations, as well as the opening of the county's Joint Information Center. Before you knew it, the EOC was in full activation mode in the blink of an eye with COVID-19. They've created various collaborative plans and projects that obviously have helped us with COVID-19. These are items in part all of us have talked about over the last couple of years during our ESC meetings that we have approved, supported, funded, and advocated. There have been exercises and training, which we secured by various grants, which included JIC training, PIO training, EOC training, and of course, the Yellow Command exercises. Proud of the fire evacuation project developed by Zone Haven, where they have since, with all our cities, helped convert a COVID-19 model map showing available essential services like medical, social, food, and pet services, a few examples. I thank Supervisor Horsley's office in working with my office to set aside a Measure K discretionary funding appropriation to make this happen. We've had tremendous response and assistance from our EOC Center in regards to San Mateo County Personal Protective Equipment Storage and Inventory, San Mateo County Event Center, temporary housing in relation to logistics, support, troubleshooting, and demobilization. The utilization of the San Mateo Event Center as a testing site and helping with logistics and support. And also the San Mateo County Mobile Testing Center in regards to logistics and planning. I would like to thank all the people in OES for all their hard work and dedication through this pandemic. It's been a crazy time for all of us, but all of you have handled the situation with such flexibility and grace. Can we give our staff just a round of applause for the work they've done? So at this time, moving through the agenda, we're going to have some updates. Our first county update is from Mike Callaghy, the county manager. Mike.
Thank you, Supervisor Canepa and members of the Joint Powers Authority. It's always a pleasure to be with you, and I get to be with you twice a week, with many of you twice a week. So this is kind of a recap of some of those milestones that we've talked about in those meetings, and a few more updates along the way for those of you who may have missed it. As Supervisor Canepa indicated about 3 o'clock yesterday, we had entered into a new phase of opening for the county with these new orders. And now we are at the floor of with the state. So we will move with the state as they move, and their orders really are now controlling the fate of those in San Mateo County. And again, as Supervisor Canepa mentioned, the focus is really on behavior from here on out. We've done a great job of bending that curve. And, you know, we're probably in the second inning of a 9-inning game here. So we want to make sure that we continue to adhere to those requirements that are in the order, mainly around social distancing, which have to do with people, obviously, and social distancing protocols, which have to do with businesses, and face coverings, again, with people, and then certainly health and safety plans for businesses. So you can see the balance there between businesses and people and how they interact. And then, as Supervisor Canepa indicated, the order also really dictates, you know, the gatherings for bubbles and for larger gatherings. So now it's really our opening further is in the hands of the state. As you all may know, tomorrow, I believe the state allows for massage parlors and tattoo parlors to also additionally open, and a few other things. And we will move towards that. As the state does, we will. So here's the thing that I've been asked that, you know, we're getting a lot of questions what we can and can't do. And we're in a position now that we are not going to interpret the state orders. We're going to refer people to the state orders and say, here are the orders, please follow them. Please, you know, if you have counsel, attorneys that for your private practice, they would need to interpret them, because we do not want to be in the business of interpreting state orders. Some are convoluted, some are clearer than others. So we're asking businesses to do that, and you can certainly go to covid19.ca.gov to get guidances, to get that guidance for business. And if you can't find it, it's probably not allowed. So it's pretty comprehensive, and it's up. So moving from that, Great Plates, I got to tell you what a great job Aging and Adult Services is doing. They're serving over 1,300 of our seniors. You know, 3 meals a day. It's been extended to July 10th. It has pumped back well over $1 million into our economy for those small businesses, small catering services, small restaurants that were really, really hurting. And in a lot of cases, it's really been a lifesaver. It's employed people. It's having the effect that we wanted. In fact, it's way greater than we could have ever expected. So it's going to be hard exiting this and developing that exit plan. So right now we know that it's good till July 10th. I'd be surprised if FEMA continued it past then, but stranger things have happened. So we've got to figure out a longer term strategy because we know people, especially our seniors, are hungry. So we got to continue to work with that. Along the testing lines, I've named Deputy County Manager Justin Mates kind of the testing czar. He's working with health. We're doing a great job on testing, but we need an overall strategy. As right now, we're doing a great job of meeting the numbers with Verily, but there is going to come a time when those numbers will slow down as people, have been tested out of curiosity or whatever and feel that, they're not positive, so they're not going to go back. So what do we do to maintain surveillance and make sure that we keep our finger on the pulse of what's going on in the community? All that is being worked out now, and we're setting priorities in regard to that. And Louise, when she comes on, may want to talk more about that. In regard to getting information out, we do have a PSA coming up. I saw the proofs yesterday with True North, our advertising company. They've really done a nice job on this. We're excited to someday in the near future show those to you. And it's all about reminding people that this is not over. This fight's not over, that you need to continue to maintain those distances, and you need to wear a mask, you need to continue to wash their hands. So we're really excited about the graphics and the way they're illustrating it. And I think that it will be very interesting. We're also looking at ways to really, there's one segment of society that has been somewhat left behind in this, and this is really the undocumented residents in this county. So I know the Board of Supervisors will be looking at this in the future. We're looking at partnering with others to address this in a holistic manner. So we'll have more information to come on that in the near future. And then we're also looking at ways to really support and bolster our minority-owned businesses who employ so many people. And these businesses were living on the fringe before COVID-19 started. And we don't want to see them just go away as we come out of COVID-19. So we're literally looking at a way to comprehensively address their needs, work with them, could create a long-term infrastructure where they can not only survive but thrive. So Supervisor McKenna, that's really my report. I'm happy to take any questions that you may have.
A tremendous job, Mike, to you and your team. Are there any questions for Mr. Callaghy? Seeing no questions, thank you so much, Mr. Callaghy.
Thank you. Appreciate it.
Okay, that brings us to health system update. Ms. Rogers.
Hi there. Can you all hear me?
Yes.
Yes,
Great.
Louise, we can.
Yes. First of all, I really want to echo Supervisor Canepa's acknowledgement of OES. I just want to appreciate, in addition to helping to lift this entire response, that we really appreciate having such expertise in the county around all of the aspects of how you mobilize an ICS structure and all of that. And we've all learned a lot through this process, and a lot of that as a result of the expertise in OES, so thank you. I really want to echo what County Manager Callaghy said about this phase that we're in now really is a pivot to a shift away from a focus on some businesses are in, others are out. It's really now, the businesses are really going to be open substantially by the end of tomorrow if they choose to be. And our focus in health is really on those basic behaviors that we know are the most effective to prevent the spread of the virus. And so in addition to hand washing, we are focused on the issue of face coverings. You may have noticed that the state today issued a statewide guidance about face coverings. And we're also still focused on social distancing and avoiding large gatherings. Although our local orders do allow gatherings up to 50 people, this is something that the health officer is really encouraging people to avoid whenever possible. So our application for the variance was a pretty big lift, and it involved almost 40 people that pulled together and had eyes on some part of it. And basically our performance in terms of the measures that the state looks at in order to consider granting a variance has been very strong. We've really ramped up testing. We've had almost 52,000 tests so far. And our case rate, we've had 5.2% of those cases were positive, but our case rate, if you look at it more recently, has started to drop. We are, though, among the top counties in the state in terms of the rate of cases. And some of that is because we've been doing so much testing. We're in the top quarter of counties in terms of testing. So that's very positive, and that means we identify more cases. So we've been very focused on the issue of hospitalizations and how our hospital capacity is doing, which is another thing the state considered before granting our variance. And those of you that monitor the data probably will have noticed that hospitalizations have started to drop. Today we had 28. But the reality is that hospitalizations go up and down, and we do expect them to in the coming months, especially as things open up. And about a month from now, we may start to see an uptick in hospitalizations. And so really the issue is, can our hospitals handle it? And we have very, very positive, information about our local hospitals' ability to surge. Frankly, at this point, they're kind of under. At this point, the utilization is pretty low, and they're trying to bring back elective surgeries and other elective procedures. And they are ready, if necessary, to clear the decks in the event that we have a surge later in the summer. Of course, we want to avoid that. And the way we will avoid that is if people continue to observe those behaviors that will prevent the spread. We're also really focused, we continue to be on the issue of cases in our congregate living settings. At this point, we've had 490 cases in 28 different assisted living, skilled nursing facilities, and board and cares. And so we are mobilizing a number of things to continue to support those facilities. Number one, the skilled nursing facilities will be doing routine testing of their residents and their staff, because generally the staff, who are more mobile are the ones that are bringing it in. And that's the way we'll be able to spot it more quickly. And we're also mobilizing a number of teams whose primary function will be to visit those facilities that don't have the ability to do their own testing or arrange for it, especially some of the smaller facilities that are serving more low-income people. And we'll be helping them with the testing in order to prevent outbreaks in those facilities. So there's been a lot of work done already with those organizations, and they've all had some some of them have increased education and awareness about this virus and how to deal with it. And we're intent on continuing to provide that support because we know they are among our most vulnerable residents. The state is going to have a process, and they do already. If you monitor the state website, you'll see that they are monitoring each county's progress on key measures. And if they are concerned about any of the measures, they will be engaging with counties to determine if there are any shifts in policy that need to be made in order to prevent a big spike up. So we will be working with the state on that. In terms of the new orders, as County Manager Callaghy said, we're not going to be getting into the business of interpreting them. As you all wouldn't be surprised to know, we're all getting a lot of calls, and we will be directing callers with really specific questions about the guidance to the state website, which is super comprehensive. We are planning to produce some kind of a placard visual system for businesses to be able to print off of our website and post, a simple, clear sign about their compliance. But we won't actually be going through a process of checking people's plans or anything like that. And the state does have comprehensive guidance. So I think that's all for my formal presentation, but I would be delighted to answer any of your questions.
Great, thank you, Louise. Are there any questions for Ms. Rogers? Okay, thank you so much, Louise, appreciate it, and thanks for taking your evening with us, okay?
Thank you.
All right, that gets us to the regular agenda. And so that's the item 5, JPA Review Committee and Summary with Mr. Silverman. Are you here, Mr. Silverman?
I am indeed.
You know, before we get started, many of you have worked with David. John Byers, who is our county counsel, has really sort of been accessible and answering a lot of questions I know from our offices and then from whether it's the city managers and the or the electeds. But I know you haven't gotten much sleep, David, but thank you very much for your service and the office's service. Thank you.
That's very kind of you. I really do appreciate that, Supervisor. So I'll try and be quick. So just very briefly, I know many of you know this. A JPA agreement is a formation document. For folks who aren't familiar with JPA agreements, you could think of it like an articles of incorporation. It's about setting up the structure and the powers of the Joint Powers Authority. There's some statutory requirements of things that absolutely need to be in them. But for those of you who've served on multiple JPAs, you probably have noticed that they're pretty cookie cutter. They tend to be pretty standard. The JPA agreement for the Emergency Services Council is a little bit unusual. It has some stuff in there that really doesn't need to be in there. It's not a problem. I actually worked on drafting the prior version, and we talked about what needed to be in there and what didn't need to be in there. And when we did draft it in 2014, there was a desire to include, like, for example, some definitions and some other things that aren't harmful, just don't need to legally be in there. One of those things is a clause that calls for a review every 5 years. That is not a standard term. I've never seen it in a JPA agreement before. I'm sure there are other JPA agreements that have it. It's not something that's legally required normally, but because it's in our JPA agreement, we need to comply with it. So as I understand, there was a committee that was set up to review under this provision the agreement and recommend to you whether any changes should be made. I met with that committee and I went through this basic spiel and I explained that you know, if it isn't broke, you probably shouldn't fix it. And the reason for that is under this agreement, like most agreements, if you do make changes, you have to take them back to every single member council for ratification, which isn't a big deal, but it takes up a decent amount of city time. So if there isn't anything in there that's causing a problem, there's really no requirement that you change it. So that's sort of my presentation. I'm happy to answer any questions. You know, I understand the committee has a recommendation and I don't want to steal their thunder.
Great, thank you very much, Mr. Silverman. Is there anyone on the committee that would like to speak to the item?
Through the chair.
Yes, Mr. Medina.
There were representatives from Redwood City, our members here, Burlingame, Menlo Park, and myself. And we did meet, and we appreciate staff's time. And as was explained by David, it was a matter of there's a lot of detail, a lot of definition. And it was thought back then that what would be available is somebody who comes in new could then read it, understand the definitions and what it transpired. As was indicated, it's not a 5-year requirement, but even if we change that, then it needs to go back to the 20 jurisdictions and we have to ratify it at each council level. So the committee as a whole, and I wish the others to please chime in, felt at this time to go ahead and maintain the current language, make no recommended changes, which then upon adoption of tonight would then solidify it for the next 5 years.
Okay. Are there any additional questions from the members or from the committee?
I have one. This is Janet.
Okay, Janet.
And I just want to, excuse me, I just want to agree with, what Councilmember Medina just said. We did agree that this would be the cleanest way of bringing it back. And it was put in there for some reason. We don't know why, but I really respect the fact that Mr. Silberman brought it to us and brought it to our attention. So I, as a member of that committee, would like for the rest of our committee to agree with the recommendation and move it forward.
Great. Is that a motion, Ms. Morgans?
So move.
And I will
May I
second
have
that.
a second.
Second.
Okay, second. Keegren, can I have a roll call, please, Madam Clerk?
Atherton,
Aye.
Belmont,
Aye.
Brisbane, Burlingame,
Aye.
Colma,
Aye.
Daly City, East Palo Alto,
Aye.
Foster City,
Aye.
Half Moon Bay,
Aye.
Hillsborough,
Aye.
Menlo Park, Millbrae,
Aye.
Pacifica,
Aye.
Portola Valley,
Aye.
Redwood City,
Aye.
San Bruno,
Aye.
San Carlos,
Aye.
San Mateo,
Aye.
South San Francisco, Woodside,
Woodside, aye.
County of San Mateo.
Aye. All right, thank you very much. That brings us to item 6, the 2020-2021 JPA budget and approval. Denise Tunick.
Good evening, Chair Canepa and members of the Emergency Services Council. My name is Dennis Tunch, and I'm a management analyst with the Sheriff's Office Fiscal Bureau. The following is a brief overview of the proposed 2021 Emergency Services JPA budget. The Emergency Services total proposed budget is $3,199,536. This is referenced as the total cost share. The total cost share in fiscal year 2019-20 was $3,021,697. The Emergency Services JPA budget is broken down into 3 components: the Sheriff's Office of Emergency Services portion of the budget, the environmental health portion of the budget, as well as dollars allocated for state mandated planning services. This last component is designated specifically for training and remains flat from year to year. There is an increase of $146,784 in the Sheriff's Office of Emergency Services portion of the budget. This increase is largely attributed to negotiated salary and benefit increases, rental charges related to the regional operations center, and modest adjustments related to various operational support charges. An increase of $31,056 within the environmental health portion of the budget is primarily due to the San Mateo Consolidated Fire Protection Contract, which provides hazmat services to the entire county. Overall, the total cost share increase of $177,839 from fiscal year 2019-20 represents a 6% increase, while service levels remain unchanged. By adopting the fiscal year 2021 budget utilizing $200,000 in reserves, the cost to all 20 city agencies would decrease by $100,000 to $1,380,407, while the county's cost would also decrease by $100,000 to $1,332,907. It should be noted the council also authorized the use of $200,000 in reserves for fiscal year 2019-20. This next slide is page 2 from the proposed budget. It breaks down the cost to all cities as well as the county. I know there are a lot of numbers here that just wanted to highlight a few numbers on the slide towards the bottom. The costs highlighted there indicate the total to all city agencies, the total to the county, as well as the total cost share respectively. Based on the information provided, we recommend the council adopt the 2021 Emergency Services JPA budget, utilizing $200,000 in reserves, and the Finance Advisory Group approved this recommendation electronically. As of March 2020, the Reserve Trust Fund held by the Emergency Services JPA held $849,396. These reserves represent the gradual accumulation of operating surplus, interest earnings, and revenue from the San Francisco International Airport related to emergency response support services. As I've already mentioned, the council approved the utilization of $200,000 in reserves to offset the 1920 budget, and this leaves a projected balance of $649,396 in the trust fund, barring any additional savings or revenue realized at the close of the current fiscal year. I also wanted to add that once approved, this budget and each city's breakdown cost will be sent to each respective city manager to ensure clear processing for the future. And with that, that concludes my presentation, and I'd be happy to address any questions you have at this time.
Great. Thank you so much, Dennis. We have Ann Snyder and then Janet Borgens. Ms.
Hi.
Snyder?
Thank you, Supervisor. Two questions. When I read the staff report, it talked about San Francisco Airport's contributions, but then I didn't see them in the charts. And the reason I bring that up is they're at least they reported last week that they're at about 5% of their normal capacity. And I would imagine they're taking a huge budget hit. Would they be able to make that contribution?
Thank you for your question, Councilmember Schneider. So the airport revenue is not listed in the budget report since it fluctuates quite a bit. We bill the airport quarterly, and the revenue is based on two factors. One, the Public Safety Communications Department net cost, as well as the number of EMS responses that are called out to the airport. So I understand your concern, but we don't expect any impact to revenue in the next fiscal year.
Okay. I think when I was on the Finance Advisory Committee, I was always concerned that we're dipping into reserves. I support the motion here, but I am again a little concerned. We're going into fire season. We've already had fires in the region. I just hate to get our reserves too low. But thank you.
Understood. Thank you.
Ms. Borgens?
Thank you. And Schneider had one of my questions regarding the reserves. The other one is, so walk me through why an increase. I get that things go up and salaries have gone up, but I've noticed that some cities, if you put that chart back up, have quite a bigger amount increase than others. So is that based on the current use?
So sorry.
Go ahead.
Sorry. Thank you for your question, Council Member. So the increases are attributed to two factors. Two factors go into the calculation. One is the population of each city, which is sourced from the California's Department of Finance, and the other half of the cost is factored based on each city's property value assessment, which comes from the county's controller's office. So I understand that there are various increases to each city, but as each city is unique in those two aspects, there will be a corresponding increase.
And then does this get looked at again after the census, the 2020 census, when we get that back?
No, but
it's based on population.
Correct. No, we weren't planning on that. And so what would happen is for the next year's budget, those new numbers would then be taken into account.
Okay. Okay. Thank you.
You're welcome.
Mr. Medina?
Thank you for the report. Thank you, Mr. Supervisor. Just a quick question. I know that you made it clear that if this is adopted, then it will be sent out to the various jurisdictions so that they're aware. With the budgets already being presented to councils, is there any mechanism that's utilized prior to that to give a guesstimate so that when the finance departments are putting together the budget, they have some assessment I know it's not up significantly or wherever it is, but I just don't, because right now our budget's done. We're going to vote on it on the 23rd. So just a question as far as process prior to the budget being presented to councils.
Thank you for your question. Absolutely understand your concern. This is something that usually goes into effect, or the process takes place in February, March. However, there are variable costs that change. As the council is aware, we sent out a change to the budget based on the San Mateo Consolidated Fire Department contract. Sometimes those changes happen last minute. So we can definitely provide an estimate earlier on if that assists with budget planning. But please keep in mind that these numbers are subject to change as time goes on.
I think an estimate is helpful, and that would probably be appreciated for each of our jurisdictions.
Sure.
Yes.
Thank you. Seeing that there are no other speakers, can I have a motion to adopt the 2020-2021 JPA budget?
So move.
Second.
Okay.
All right, thank you very much. I think it was a motion by Chuang and seconded by Adam Rack.
Yes.
Thank you. Can we get a roll call, please, Madam Chair? Clerk.
Belmont,
Aye.
Brisbane,
Aye.
Burlingame,
Aye.
Colma,
Aye.
Daly City,
Daly City, aye.
East Palo Alto,
Aye.
Foster City,
Aye.
Half Moon Bay,
Aye.
Hillsborough,
Aye.
Menlo Park, Millbrae,
Aye.
Pacifica,
Aye.
Portola Valley,
Aye.
Redwood City,
Aye.
San Bruno,
Aye.
San Carlos,
Aye.
San Mateo,
Aye.
South San Francisco, Woodside,
Woodside, aye.
County of San Mateo.
Aye. Thank you very much. Thank you to Dennis and team. That brings us to item 7, Vice Chair nomination. I guess under our bylaws, we have to nominate someone to serve as the Vice Chair. Marie Chuang.
I nominate Rico Medea to be the vice chair.
Second.
Okay, so we have Borgens, we have Keegren. So let me ask you, are there any other nominations from the floor? Seeing none, the motion was by Marie Chuang, second by Borgens. Can we have a roll call, please?
Atherton,
Aye.
Belmont,
Aye.
Brisbane,
Aye.
Burlingame,
Aye.
Colma,
Aye.
Daly City,
Daly City, aye.
East Palo Alto,
Aye.
Foster City,
Aye.
Half Moon Bay,
Aye.
Hillsborough,
Aye.
Menlo Park, Millbrae,
Aye.
Pacifica,
Aye.
Portola Valley,
Aye.
Redwood City,
Aye.
San Bruno, I guess not. San Carlos,
Aye.
San Mateo,
Aye.
South San Francisco, Woodside,
Woodside, aye.
County of San Mateo.
Aye. Congratulations, Rico, Mayor Medina. Looking forward to you being the vice chair. I've seen, over the years, we've seen a lot of what San Bruno has gone through relative to the fire, YouTube. But there's no one, I think, more well-positioned to fit this vice chairmanship than yourself. Congratulations.
Thank you,
That
everyone.
brings us,
Supervisor Canepa?
yes,
My apologies to Councilmember Weist. We cut you off during the budget. If we could capture your recorded vote for the budget.
Oh, I thought you didn't want that. Aye. I didn't know what that was in there. I'm like, I know I said I was here, but I've been here quietly, but I do it.
Thank you, sir. My apologies.
thank you so much. So that brings us to public comment and questions. Do we have any public comments or any member reports?
Supervisor,
I
nothing
see
showing.
Reed Shuang and,
Oh,
pardon me?
No public comments, but correct going forward with Councilwoman Chuang. Thank you.
sorry, I forgot to lower my hand.
Okay, no problem. Ann Schneider, Ms. Schneider?
Thank you, Supervisor. I don't know if I was the only one on Emergency Services Council that received the email from Mike McKeon. Mike, I don't know if you're on the call. He's with our Sheriff's Department, and they have completed the draft for the San Mateo County disaster, the DDMP. Sadly, I can't open the document yet, but it's our disaster management plan for debris materials. And this is, first of all, I'm very excited about this. This is the field that I work in. They're going to have a workshop on July 8th from 1 o'clock to 3 o'clock. So I would assume it'll come out to the emergency services people. Now, I happen to have been on 2 different phone calls today dealing with solid waste issues. I think we're very fortunate in San Mateo County in that, as far as I'm aware, all of our garbage and collection services continued. In Southern California, they actually shut down a number of recycling and collection programs and pushed back rolling out other programs that we'd had up here, frankly, for years. So COVID did have a hit on just general residential collection in the Southland. This right now is looking at more like an earthquake or a flood or things like that. But hopefully we will also consider that had COVID hit in a slightly different way, it would have affected our solid waste workers and how lucky we were. So I talked to the supervisor and was curious if there were a couple of other people in the county who would like to work with me to review this and make sure that we're looking at each community on this. In my experience, physical location can have a lot of bearing on how quickly you can or cannot clean up after a disaster. So if you're on the coast side, you're on the other side of 92 or Highway 1 that could get shut down by a mudslide, a landslide caused by an earthquake or rain. What happens here in North County can be different than happens in South County. So I would love to create a short-term subcommittee to look at the DDMP.
Okay, so is there anyone who would like to serve with Ann on this committee?
I could, Janet.
Okay, we have Janet. Is there anyone else?
I was hoping somebody co-side so that we make sure that we're taking all of your considerations into consideration.
Does that mean we can go there and have our meetings?
I love that idea, Janet.
If
We
you
might not
come-
be able to
if you
carpool,
come
though.
Here, I'll volunteer.
Thanks, Deborah.
Excellent. I also have just been appointed to the statewide commission on recycling markets and curbside recycling. So I'll be able to wear both hats on this. So Supervisor, I appreciate that.
No problem, and thanks for the suggestion, and thank you, Deborah and Janet, for stepping up and stepping in. Really appreciate it. So our next meeting is in August. No, I'm kidding. Our next meeting is on September 17th, 2020. We'll adjourn this meeting, and thank you for your attendance.
Thank you.
Thanks, everyone.
Thank you.
Thanks,
That was
everybody.
quick.
Be safe.
Happy Father's Day.